Sarah Welsh here, and this is your tutorial on the client intake form and what does all of this mean. So simple, change your logo, right click on the image and choose change picture, self-explanatory. The business name that you would delete and put your business name in there. Obviously client information, important, email is very important, date of birth. It's nice if you want to be able to send them birthday cards or offer them a discount during their birthday month. Street address if you ever want to send them a handwritten card or a present in the mail or any sort of marketing offer, you can mail it to them. All right, are you on any social media platform? Now, for the most part, it's probably Facebook or Instagram, but it is good to know if you start getting a lot more clients with either Twitter, Google, or Periscope, that maybe there's an opportunity for you to market on those platforms. It's just to gauge where your clients are and where more of your potential clients may be hiding as well. So client history, and this, again, you're going to want to kind of take some of these with a grain of salt. As some clarity, I am not a doctor. So a lot of these conditions you're going to want to research on your own or have them check with their doctor to make sure it's safe for you to continue. So have you had eyelash extensions before? This is part of your consultation, so you're going to want to know if they've had lashes before, what did they like, what didn't they like. Are you pregnant or nursing? This can affect hair growth cycles. Hormones can affect the hair growth cycle, and you may choose to not lash someone who's pregnant. That is completely up to you. Do you wear glasses on a regular basis? The reason I have this in there is because you need to consider the length at which you're going to put the extension so that they don't hit their glasses. You may have them put on their glasses so you can see how far you go. For the most part, for me, and what I've noticed is if I have a client who wears glasses, I never go longer than a 12 millimeter, and oftentimes I will go shorter because as they start to grow out, they'll start to hit the glasses, and that can be very annoying. Some clients, their natural lashes hit their glasses to begin with, in which case you don't want to add any length. Do you wear contacts? It is really, really important that your clients remove their contacts prior to service. God forbid any sort of adhesive should come into contact with their eye and glue the contact to their eyeball, which is a medical emergency. Also, it can just be more irritation to the eye, especially if their eyes don't close fully. So we don't want that. We don't want any of the vapor or the fume getting trapped underneath the contacts. So if they remove them prior to service, that is awesome. Do you use fiber or long-lasting waterproof mascara? If the answer is yes, they stop that immediately. So, as most of you know, waterproof or long-lasting mascara is oil-based and our adhesive is oil-based, so they do not play well together. So it takes something oil-based to get the waterproof mascara off the extensions, which will then take off the extensions themselves. Fiber mascara is just a nightmare as well to get off, so just tell them no mascara. If they have to, use something that's oil-free. Do you use Retin-A or Accutane? So if you are not an esthetician, those are vitamin A based skincare products for either acne or anti-aging. The most important thing you need to worry about if that is someone, or if they check the yes box, is that it makes them photosensitive, which makes them sensitive to light. They sunburn really easily. They need to wear sunscreen. So if you are either near a window or you have a light that puts out some heat, that can affect them. So just being aware of that. Do you go tanning in a salon, outdoor, or spray tan? It's nice if you offer spray tans to know if they get spray tans. You could offer them a package for lashes and spray tan. They do need to wait probably at least 48 hours after their application for a spray tan, and they don't want to get it the same day of their lashes because if you're doing your due diligence and cleansing their lashes, it's going to take off the tan that's around their eye area, and that would make them look like a raccoon for the duration of that tan. In salon and outdoor, again, they want to wait at least 48 hours. Our adhesive is very heat sensitive, so while it's in its curing phase, it can get gummy if it is exposed to a lot of heat. You receive regular facial treatments. If they do, they just need to make the esthetician aware that they have eyelash extensions so that no oil-based products or steam go directly onto the lashes, and they can use either cotton pads, although not ideal to have cotton anywhere near the eyelash extensions, or they can use those tanning goggles to put over their lashes so that they're safe from any oil-based products or steam. Do you use Latisse or any other lash growth product? This will help you to understand their lashes and their maybe what might be going on. So if they start to develop redness around the lash line, is it because of the lash growth serum? Are they developing an allergy? Is it seasonal allergies? It just is more information for you. Also, if they're not and they need it, this would be a good opportunity for you to retail a lash growth serum to them. Are you allergic to acrylate or cyanoacrylate, a bonding agent? So the main adhesive or the main bonding agent in our adhesive is cyanoacrylate. So it is part of the acrylic family. So same as acrylic nails, it all is part of the same family. So if they have an allergy to any adhesive nails or acrylic nails or cyanoacrylate, then they are not candidates for lash extensions. If they have a sensitivity to it, again, they are not a candidate for eyelash extensions. Allergies, once developed, are for life. No amount of sensitive adhesive or you trying to play nice with the glue is going to change that. So it's good to know that before you ever get started. Have you ever reacted to adhesives, tape, nail, or other topical products? This is also a really, really great question. Again, if they've had an allergic reaction to acrylic nails, they are likely already allergic to an acrylate, so they would be highly at risk for an allergy to our adhesives. We do use a lot of tape in our services, no matter how strong or how detacked the tape is. Some clients are just allergic to that. Any history of eye disease, condition, injury that has affected hair growth. So again, we're not trying to make things worse. We're trying to just take what they already have naturally and make it better. So if they have any eye disease, condition, or injury, that has to be stated so that you know what you're dealing with. If it is recent, then they need to reschedule for when things have settled down and they've gotten a doctor's release that they can move forward with eyelash extensions. Do you work out heavily, sweat excessively, swim, or use saunas regularly? So again, this is something you can go back to as far as if you run into retention issues. Now, somebody who sweats excessively is not necessarily not a candidate for eyelash extensions. However, it does mean that they do need to clean their lashes regularly because that sweat will get into the lash line and just sit there and breed bacteria. If they have oily skin to begin with, that sweat is bringing some of that oil into the lash line, which may cause retention issues. If they swim and it's in a pool, they need to wear goggles, which for the most part swimmers do. And if they use saunas regularly, again, they need to wait at least 48 hours. So if they're ever running into retention issues, start looking at lifestyle and see if that might be affecting it. All right, all medications you're taking, over-the-counter, supplements, and vitamins. So this can also help you establish any issues that might be caused by something they're taking internally. Now, again, you're not a doctor, so don't ever tell them, don't take this, do take this, unless they check with their doctor first. So some of these can be thyroid medication, can affect hair growth. If they're taking any sort of biotin, that can really affect their hair growth in a good way. Prenatal vitamins can help in a good way. Just kind of get a general feel for what they're going through. Yeah, we'll move on. So any of these eye conditions. Now these are a plethora of contraindications. Some you can work around, some you can't. Use your best judgment, and when in doubt, have them get a note from their doctor. So alopecia, just a real quick overview of these. Alopecia is an autoimmune disease where their hair just naturally falls out, kind of like a chemo patient would go through, but this is usually either hormone or stress induced from my understanding of it. Diabetes means that they have a harder time healing, their body has a harder time healing and repairing itself. So if you were to cause eyelash damage, or they were a picker at their lashes and pulled out their natural lashes, it would take their body a really long time for that hair to grow back. Ocular rosacea and rosacea, again, it can be light sensitivity, it can be product sensitivity. The vapors from the adhesive may be irritating to their skin. Asthma, again, with our adhesive, if they're inhaling the vapors, it may trigger an asthma attack. Dry eye syndrome. I've had a couple clients with this. Their eye drops tend to be a little more oily, so sometimes that can affect retention. This is something that anything having to do with eye, they really need to get their ophthalmologist okay for eyelash extensions just because you don't want to make anything worse. Sensitive eyes, this is good to know for watering, anything you can do to kind of keep the eye area just cool, calm, and relaxed. Back pain injury, again, if they can't lay on their back for the full 2 hours for a full set or 3 hours for a volume set or for the touch-up appointment, if they have to get up a lot, then they're probably not a good candidate until the injury has healed. Eye sites and sores, that's something you definitely don't want to touch. Anything with an open wound, any staph infections, anything like that, they need to come back when everything has healed up, because you do not want A, you touching it, or B, your utensils touching it as well. Already got that. Bell's palsy is not a stroke, but it has a similar effect where just half of the face gets paralyzed. So any of you touching their skin, their forehead can be unpleasant for them, or it can affect their recovery. So that is something you want to wait until the symptoms have subsided and their doctor gives them the okay. Herpes of the eye, see a doctor. Stroke, see a doctor. Blepharitis, now this is something some people know that they're prone to. So a lot of older clients and people who just are in general more susceptible to blepharitis, not a good candidate. If blepharitis starts to occur while they're getting eyelash extensions, it could be hygiene related, that they just need to cleanse more. Eyelash extensions cleansers are really great now that they really help prevent the symptoms and signs of blepharitis. But again, if they already know they have it, it's not likely that eyelash extensions are going to help. So when we add an extension to a natural lash, we're increasing the surface area, so we're increasing the things that get caught in our natural lashes, and we are also increasing the space for bacteria to breed. So let's just leave anybody who already knows they're prone to blepharitis as somebody who's not a good candidate for eyelash extensions. Intense stress can affect every system in your body, including hair growth. Thyroid disease, again, medications associated with that or the body's lack of that hormone can affect hair growth. Claustrophobia is a pretty good one, because when they have got their eyes closed, maybe they're wrapped up in a blanket, they have to keep their eyes taped shut, they've got the iPads on. If you put on one of those lip masks, they're going to have a full-blown panic attack. So somebody who's claustrophobic is not the most ideal client. It can be worked around, but they have to understand what they're getting into, that their eyes have to remain closed for the whole time, that they cannot sit up. It's just not ideal. Lamy eye, see a doctor. Trichotillomania is a fun one. That is where somebody has a nervous tic that they pull out their eyelash extensions, or it's this kind of obsession with pulling out their hair. Not a candidate for eyelash extensions. They will cause damage. Cold sores, see a doctor. Light sensitivity, this one's tricky. It usually tends to be for those with blue eyes. Their eyes just absorb more light even with their eyes closed. You can try and work, I've seen people put foil over the lashes or over the eye and work just on one eye. I've seen black towel on one eye. You just really want to slowly introduce light to their eye. If they water a lot and you just can't work around it, then they're not a good candidate for eyelash extensions. Do not strain your eyes for a client who is light sensitive. Recent eye surgery, they need to wait until everything is healed and their doctor gives the okay. Conjunctivitis, pink eye, they are not to even enter your shop until they have been on antibiotics for, I think it's a week, but have them checked with their doctor. Anybody who has pink eye and you touch that person or any of your utensils, it spreads like wildfire and it's not worth the risk of your reputation. Migraine, again, this can have to do with the sensitivity to the fumes of the adhesive or the light. It's just good to know if it's manageable, great. If they are triggered by any products that you use, then maybe they're not a candidate. And current eye irritation, again, they need to see a doctor and they need to not get eyelash extensions until they are good to go. So that's just kind of a brief overview. Again, if you're concerned about any of these, always refer them to their doctor. You're not the medical professional, you are just a beauty service provider. Keep that in mind. All right, last couple of questions. Which side do you most often sleep on? Again, you can refer back to this if they start to have retention issues just on one eye. Keep in mind that nothing in our body is symmetrical, so we do not shed our body hair symmetrically. So it is common for one side to shed out faster than the other. The most chronic clients that have issues are those that sleep on their stomach because they are digging their face into the pillow throughout the night. You'll notice these people have on their outer corner of their natural lashes, they tend to curl in and just get wild and crazy. So again, ideally they're sleeping on their back or on their side with their face slightly lifted off the pillow. But what I tell my clients is, you're sleeping, you have no control over what your face does. We'll do our best to work on retention, but just know, due to the way that you sleep, there may be retention issues. You may have to come back sooner. And how fast do you feel your hair grows? For most people, it's normal. They don't really pay attention. Some people know that they grow hair really, really fast. Some people know that they go really slow. Could be due to hormones, could be due to stress, just could be their natural cycle. So that gives you an idea of how often they'll need to come back for touch-ups. And then, is there anything else you think I should know? This is a great opportunity for them to open the door for any conversation. Um, in addition to a client intake form, you do need a client consent form. Now, because I'm not a lawyer, I cannot give you legal advice. So this would be something that you would talk to a lawyer or your insurance company about. You do need things like a consent to release or to use the before and after photos for marketing purposes. That's a big one. It's always good to declare the risks that are involved with eyelash extensions, that they will follow aftercare instructions to keep their natural lash health intact, just kind of some of those things. But really, it's best to have your lawyer go over it. If you don't have a lawyer, I've done rocketlawyer.com, which is a US-based lawyer service where I can run a contract by them real quick, or you can ask some questions. It's cheap instead of having to have a lawyer on retainer. LegalZoom, I think, is another one. There's just some places where you don't have to hire or speak to a lawyer in person necessarily, but it is worth your investment and the protection of your business to make sure that clients sign a consent form so that you are covered legally and your insurance is on board as well, because they would be the ones that would cover you in case any liability suit comes after you. All right, any questions on the intake form, please feel free to email me, hi@thelashpreneur.com. Thanks for joining.